At some point I became unresponsive, but what she didn't know is I had moments where I could hear her. She would touch my arm, stroke my hand, and continue to talk to me like I was a person and I was still in there. She had no idea I could hear her, as I was unable to communicate.
It's important to remember there is a person in there, and even if they can't speak at that exact moment, somebody has to speak for them. And I think as the bedside nurse, someone who spends 12 plus hours with them, sometimes multiple shifts in a row, that's our job, that's our responsibility to do that for them.
I started my career at Albany Med actually at their daycare center. Became an RN and started working in the NICU. Worked in the NICU for over 20 years and eventually ended my career there. During my initial admit, I became very ill and then was transferred from the cardiac floor to the MICU. All of the night nurses on that floor worked endlessly to try to stabilize me and eliminate various sources of intense pain while monitoring me from recovering from a seizure. Katie was the day nurse who took over. She is a fierce advocate for her patients. At some point I became unresponsive, but what she didn't know is I had moments where I could hear her. She made the scariest moment of my life less scary. I didn't need to panic because she truly had my back.
We really don't know all the time that people can hear us or not, or that they're totally understanding everything we're saying. But I think it's important to just treat everybody as if they can, and treat everybody like the human being that they are, whether they're awake and alert or not.
Outstanding patient care has a lot to do with integrity, doing what's right for the patient, advocating for the patient.
It's a very overwhelming experience to be in a hospital, especially if you have multiple things going on. You don't always know the right things to say for yourself. It's scary to speak up on behalf of yourself, especially if you're not familiar with what's going on.
A good nurse is made up of many different things. I think an interest in quality patient care, having a desire for compassion is something that you can't miss with a good nurse.